Okay. Again, welcome everybody. My name is Provider Outreach and Education Specialist with WPS Government Health Administrators, and I want to welcome you to our Provider Enrollment Application Fee and Site Visits webinar this morning. I will start with our disclaimer. The material presented during the session today, it's accurate as of today. As you know, Medicare changes often, so please make sure that you're always reviewing official CMS communications, which does include the CMS and the WPS GHA websites for the most up-to-date CMS rules and regulations. Now, the material being presented today was prepared based off of those CMS regulations along with pre-submitted questions that you sent in during that registration process. And I'll be answering those questions as part of the material. Some of those pre-submitted questions along with any questions that you asked today, again, using the current CMS regulations. I also need to remind you that photographing, screenshotting, or recording of this education for profit-making purposes is strictly prohibited by CMS. As I mentioned moments ago, I am recording this session, and that will be made available to you, barring any technical challenges with the recording, as soon as possible after this session. So that recording is going to be posted on our YouTube channel as an encore, and this is going to allow you to view it again if there's something you wanted to see again, something you missed, want to that was not able to attend today would find that information helpful. You can share that with them as well. So you'll have that. I'll start with our agenda today. Today we're focusing on provider enrollment application fees and site visits. This session will provide you with an understanding of the purpose of the site visits and the enrollment fees and when to expect a site visit or enrollment application fee will be part of your application process. We will also talk about the amounts for that fee, how that's set, how you're going to pay that fee, and then in addition, what to expect during those site visits. I am going to start by talking about site visits. I want to make sure that you understand it's important to remember that site visits are 100% about preventing fraud in the Medicare program and protecting the Medicare trust fund. They have identified the providers that are going to require a site visit based on potential risk or historic risk to the Medicare program. If you've attended one of my webinars before, you've heard me say this before, the best way to prevent fraud is to prevent bad actors and those that would do the Medicare Trust Fund harm from entering the program and accessing those funds in the first place. So just keep that in mind as we go through site visits. So site visit requirements are based on screening levels that are established CMS. These screening levels are outlined in the Program Integrity Manual, or the PIM, and I will take you out to that in just a minute. It's Chapter 10, and it will be Section 10.6.15. It's risk-based screening. Let me go out there quickly. And I just went straight out to the manual, but what I want to get there without that link. However, I have provided that link in the resources for you today, so you have that. So from the CMS.gov website, you will access the Program Integrity Manual by scrolling down to the top resources. There are other ways to get there, but this is the most efficient. Manuals, forms, and transmittals have consistently been the top resources for years, so you'll always be able to find that PIM right here. Under manuals, forms, and transmittals, you're going to drop that list down, and you're looking for internet-only manuals. Oop, sorry about that. There we go. Once you access the internet-only manuals, we're looking for that Program Integrity Manual, which happens to be Publication 100-8. Again, you'll also hear me refer to this as the PIM throughout this session. Once you're in the Program Integrity Manual, the section that provider enrollment does, all of their regulations are in Chapter 10, Medicare Enrollment. And once you're here, I had already done a search, but once you're here, you'll get a table of contents. And inside of this manual, again, section 10.6.15 is for risk-based screening. This is where it's going to outline the different risk categories. And I'm going to talk through all of those. I wanted you to see where you can locate that information. This particular manual reference is very helpful if you're getting ready to enroll. Site visit is going to be required. Now this section is specific to that risk-based screening based off of for the purpose of needing the MAC to request a site visit. And what you'll see is here I'm looking at limited risk. It's going to include the providers types and specialties that are subject to this risk category. And then below that listing, you will see the guidelines. And again, we're going to talk about through all of these, but you'll see the guidelines of when a contractor is being instructed to ask for those site visits. And if I continue to scroll down, you will see high risk as well. Moderate, for some reason, there we go. There was just a little bit break in the page. Moderate risk is here as well. So again, those categories, this document is going to be really helpful in identifying which category your provider is in. So the site visit's purpose, before we go into those categories, is primarily, like I said, fraud prevention, but they're primarily looking for the practice location to confirm that it is in an operational status. It exists. It's not a vacant lot. It's not, there is patient activity there. Again, just making sure that it's there and in an operational state. If you have a provider that has multiple practice locations, you will be subject to multiple site visits. The site visit isn't just about the tax ID. That verification isn't just about the tax ID. It is about every practice location being reported when a provider is required to have a site visit. We have to make sure they're all in operational status. And once that site visit is complete, a report is sent by the inspector. These site visits are not completed by the MAC. They are completed by a national site visit contractor. We'll talk about that a little bit more in a few minutes. But then that report is sent to the MAC, and that MAC is making that final decision based on the inspector's findings. The inspector is not making the enrollment decision. That is still placed with the MAC. So we'll start with the limited risk level. This is the lowest risk level, and it is something that CMS has deemed providers in this category to be relatively limited risk to the Medicare Trust Fund. This risk level, limited risk level, does not require a site visit during the enrollment process. It's typically the category where many, if not most, providers fall. So again, site visits does look at the provider as a whole. So some examples that fall into this category, and this is not an all-inclusive list, I did just show you that inclusive list in the Program Integrity Manual, are going to be physicians. So your MDs, your DOs, your chiropractors, dentists, podiatrists, they're going to fall in that category of part of their enrollment process is not going to involve a site visit, even if they're in private practice. Most non-physician practitioners also fall in this category, and I say most because there is an exception to this, and we'll touch on that when we get to the moderate risk level, but there is one non-physician category that falls into the next level and does actually require a site visit. But when I'm talking non-physicians, nurse practitioners, the mental health counselors, marriage and family therapists, physician assistants, these are all non-physician practitioners that are going to fall into limited risk. The other thing you're going to see is that we're not doing site visits on medical practices as a whole. Again, there is one type of group practice that falls into into a category that does require a site visit, and that is when it is a site that is 100% made up of physical therapists. Physical therapist is also that non-physician that does require a site visit. And we'll talk about that in a minute. But typically group practices are not going to need those. And then there are some facilities, both Part A and Part B, that are not necessarily going to require that site visit. And again, that is where, if you come out to the PIM, this is going to be very helpful. So for instance, I'm looking at limited risk. I'm looking at the facilities that don't require a site visit, and you'll see that we have ambulatory surgical centers, federally qualified health centers, hospitals. These are entities that don't generally require a site visit for enrollment. Moving on to the moderate risk level. This is the second level of risk, and this is a category that does require a site visit. It requires site visits anytime a provider falling into this category submits an initial enrollment, and that can be new to Medicare or new to a jurisdictional state. So for instance, you could have a provider that's enrolled in Michigan. They've had a site visit for that practice, they're billing, things are great. Now they're going to want to expand their practice, and they're now practicing in Indiana. When they submit that Indiana application, they are considered an initial, a new provider, again, to that jurisdictional state, and would be subject to this same site visit requirement. Providers are also, that fall in this category, are also required to have site visits for revalidations. Remember, the revalidation process is basically a re-verification or a recertification of all of the information that we currently have on file for a provider. So they are completed very much like an initial enrollment, including reporting all of the practice locations that should be on file. And all of those locations will be subject to a site visit. And that revalidation is every 5 years. So you'll have a site visit if you fall into this category when you do your initial enrollment. And then on that every 5-year cycle, as you submit revalidations, you're likely going to see additional site visits. The other scenario where a provider in a moderate risk category would need to have a site visit would be if they're adding new locations, expanding the practice, or perhaps they're moving, they have a new practice location. Just like all of the existing locations, we need to verify that new location is operational. So as I stated before, this isn't about the provider, this is about the locations that are being reported on the application. And I want to be clear, it's just the practice locations. We're not sending out site visits for the contact addresses or the correspondence addresses or the special payments addresses, unless they also happen to be one of the practice locations. We're focused on the sites where services are being rendered to Medicare beneficiaries. So some examples of providers that are going to fall into this: physical therapists. That is a category of provider that CMS has identified as moderate risk. So if you have a physical therapist that is even joining a group and they are brand new, you may be asked to have a site visit. And I say may be because this is also a category where if they're joining a group that's had a site visit in the last year, or perhaps they're sending multiple, we may not need to do that site visit because we've already verified that that practice location is operational. Okay? They typically last for a year. Ambulance service providers, those are also going to fall into moderate risk, and I bring them up as an example. Again, this isn't all inclusive. However, ambulance service providers, sometimes there's some confusion with it because we are going to go to any address listed in Section 4, but that includes where the vehicles are garaged. If it's an air ambulance, we're going to be looking for where the aircraft, whether that's helicopter or fixed wing, are going to be hangared. if you will. We are going to check for dispatch locations and if there's a base of operations. We're again making sure all of them are operational. And ambulances are a little bit different because their locations are not necessarily where they're rendering service, but it's where they're initiating services from. And then we'll also do site visits for independent clinical labs. Like I said, this is not an all-inclusive list. If I take you out to the PIM, you will see the all-inclusive list here. Okay? And it does include the scenarios and application types of where we would need to request that site visit. So you have that. The last risk level that we have is the high risk level. This level does require a site visit, and there are certain providers that are required to fall into this category. And that includes skilled nursing facilities, Medicare diabetes prevention programs, and hospice. Again, not an all-inclusive list, and this list can change just a little bit. This risk is different from moderate in that there's also the likelihood that owners of the facilities or the provider that had been classified as high risk level is going to be asked to provide fingerprints to CMS. These are providers that have been identified as a high risk to the Medicare Trust Fund, and it is possible for an existing provider, including any individual provider, to be elevated to this level. Now, if a provider is elevated to this level, it is typically because they have had an adverse legal action that deemed severe enough to warrant that bump up to, or that elevation to that high risk level. So situations that could cause that for a provider who's otherwise in the limited or the moderate category could include such things as having been excluded by the Office of Inspector General. Maybe it's a provider that's on our preclusion list that's now trying to enroll. We most commonly see it if we have a provider that's been previously revoked or they have a felony conviction in the previous 10 years. Now, this high risk level is providers on this risk level are identified by CMS, and that is communicated with the MAC. You would receive communication regarding any fingerprinting activities. It's not that common, and it would be something that the communication would provide instructions on how to submit those fingerprints into CMS. So next, let's talk about what to expect on a site visit. So as I stated before, site visits are performed by the National Site Visit Contractor, and they will send out inspectors based on orders that are being submitted to them through PACOS from the MACs. So when that site visit order goes to the National Site Visit Contractor, they're going to include the addresses that need to be included on the site visit. They're going to include hours of operations. We make every effort possible to make sure that we provide hours of operation to the site visit inspectors so that they do not show up in the middle of the night at a facility that's not open, so that they are showing up during business hours. Okay, those inspectors are going to carry a photo ID that is CMS issued, and you can ask to see that. They're also going to be carrying a signed authorization letter. The visits are going to be unannounced, though. These are cold visits. They are not scheduling visits. CMS is not entertaining that. However, that is also why we're asking for office hours. So you're telling us that that site operates, even if it's only on Mondays and Thursdays, between 8 a.m. and 4 p.m. In that scenario that I just described, the inspectors would only go out on those dates between those hours, okay? But they will not schedule that they're going to show up at 1 p.m. on Thursday. That's just not something that they will do. The idea, again, is to visit the site during normal business hours to make sure that it's operational. Once they have done their site visit, and we'll talk about the different types of site visits that they may do and what's involved in those in a minute. But once they have completed that site visit, they are going to send a report to the MAC, again, through the PAYCO system, and that's going to include a documentation of the visit. What did they observe? Did they have any conversations with staff? Are there any um, observations that we need to be aware of that might steer or might help us make our enrollment decision? Again, those inspectors are not making that enrollment decision. That is still the MAC, because the MAC understands the qualifications, the things that are required for enrollment. Those reports are also going to include a couple of photos. The photos are typically of the facility, of the signage. They're not of the people inside. There are situations where they might have to take pictures of therapy equipment or just equipment in general. But again, that is all just supporting that, yep, we came out here, this provider is operational, this site is operational, it's good to go. So there are a couple of different types of site visits, and the most common, the most prevalent is the observational, and that's going to be pretty minimal contact with the provider. So you might not even know that the inspector was there. If they would come to the site, again, we're looking for them to come and do that site visit during normal business hours, based on hours that you either provided to us or that we were able to get from you during a development. So they're going to take the photos that they need. They may not need to enter the facility, and they're not going to hinder with your day-to-day operations, because in this case, they generally don't need to have communications with staff. But again, like I said, they are carrying a CMS ID, and they're carrying a signed letter that's authorizing them to carry these out. So you certainly can ask for that. The other type is detailed, and this happens a little bit more. An example would be with an independent diagnostic testing facility. So an example would be a facility that maybe does MRIs. So they have their MRI machines. Based on their enrollment requirements, they have to meet certain CMS standards. So they're going to have a slightly more detailed site visit. In that case, the inspector is going to enter the facility. They're going to likely speak with staff, and they're going to confirm compliance with standards, which means they may need to see different areas of the facility. They may need to see equipment. It's not going to be super invasive, but they are definitely going to be more detailed. Ask questions. You're going to be aware that they're there. Now, this can happen if you're in a high-risk situation as well. That might warrant a slightly more detailed inspection, again, based on why maybe a provider is in that high risk category. So just things to keep in mind. And the same thing here, photos of the facility are going to be taken. Again, they're looking for, is this operational? That's going to be the common theme through here. So some tips to ensure that you have a successful site visit: notify your staff of the site visit. So again, I've shown you the PIM. That's going to help you kind of predetermine the need for that site visit. However, that's not the only way you're going to know that a site visit is going to occur. When an application is received and it is screened, once an analyst in the provider enrollment department identifies the need for the site visit, they will send out a notification that your provider is going to need a site visit based off of which category. It's going to provide that information to you, so you'll know. It's not going to give you a date and time. It's going to tell you it's going to happen during normal business hours, but notify your staff that site visit is happening. That way they're aware, hey, somebody might be coming around, taking pictures, might need to come in. But if they know that, then the inspector can carry that out sometimes a little bit more easily. The next thing would be to provide those hours of operation. Before ordering a site visit, provider enrollment analysts are absolutely going to reach out to the contact and ask if they can't find it elsewhere in the application. So if you're including anything on office letterhead, if that has the hours of operations for that location, they're going to look at all of that. You can be proactive and include that in your application submission if you know that you're a provider type that's going to require that site visit. But again, just being proactive, letting us know that. Again, it's not everybody. This is where leveraging the PIM and knowing that, hey, I'm going to need a site visit, so I'm going to give them the hours of operation. That is super helpful, and it will help that site visit go more smoothly. Also, we do recognize that sometimes there might be quirks to getting to the site, to accessing the site door, depending on how the building is set up. We've seen situations where maybe a provider doesn't have their sign on the main sign for the building. You have to actually go to their suite door to have their signage for their office. Include those instructions for us. Ambulance services is a really good example as far as, hey, when you get there, you have to call so-and-so and somebody will come down. That can happen, say, like with a volunteer fire department where somebody's not necessarily staffing the garage or the garage location 100% of the time, or the office operation hours might be a little bit more irregular. So just including that information is super helpful because we will include that in our order to the inspectors so that they can work within those parameters. So that brings us to our first point for questions. I am going to start with a pre-submitted question. The pre-submitted question was, how long is the wait for a site visit? This is an excellent question. Now, the timeframes vary based off of the type of application. So the inspectors do have timelines, just like the MACs do. For an inspector, if you're submitting a revalidation or a change application and we need a site visit, the inspector has a 30-day time frame. And that is in line with if we need any development on the application, you also have a 30-day time frame to respond. So what we have done is we do those simultaneously. So the site visit is ordered right away when we're screening the application. And if we identify that there's any discrepancies, missing information that we need to develop for, things we need clarified that we need to develop for, we will send out that development letter at the same time that we're ordering that site visit. And so the idea here is that we are developing at the same time that we get the site visit. Most often site visits, we don't find reasons where we're going to be in a situation we have to deny a provider. So we're not holding up that development. We're doing it at the same time. We oftentimes will see those site visits come in more quickly than that. And I can tell you that the provider enrollment department does check pretty much weekly on any site visit in case that site visit comes back super quick. So you're not going to automatically be waiting 30 days because of a site visit. We will check, like I said, on a weekly basis. If we have all the information that we need and the site visit came back in 7 days, we're going to move that application forward. So that's continually monitored. Now, for an application that's an initial enrollment, that's going to be a 15-day time frame. That's a new provider that is an unknown quantity to us. So we want the inspectors to turn those around just a little bit quicker to make sure that we're making that enrollment decision quickly. So those are those time frames. Again, same thing here. If there is development, we are sending out development at the same time that we're ordering that site visit and sending that site visit letter. Okay, so with that, I'm going to check in with Bailey. Bailey, do we have any questions in the chat?
Not any that haven't been answered already.
All right, excellent. Thank you. So now we're moving on to enrollment fees that may be required for your application. I'm going to start with just some basics. So first and foremost, enrollment fees, they are a separate requirement from site visits. So it is possible that a provider that's required to pay an enrollment fee might not need a site visit, or a provider that's required to pay a fee, to have a site visit might not require a fee. And there are some entities that are required to do both. And we're going to show you a handy dandy matrix. Obviously, the PIM that we've shown you is going to regulate the site visits, but this matrix that I'm going to walk through here in a few minutes is going to show you when you need a fee. So I'm going to show you where that is. I've also included a link for you, and I encourage you to reference both items to know which category that you're going to fall in. So enrollment fees are for institutional providers, and it's not all of them. But institutional providers, meaning that these are providers that are billing Part A and they're filling out the CMS 855A, or they're a facility that's billing Part B and they're filling out the 855B. Application fees are not required for professional group clinics, so a regular medical clinic, physical therapy clinic, those providers are not required for fees. Also, the other facility that is excluded are going to be Medicare Diabetes Prevention Programs, or MDPPs. The MDPP is also a good example of a provider that's required to have a site visit, and you saw that. They're actually considered high risk, but they're not being asked to pay an application fee. So you've got to check both requirements. The two are not necessarily intertwined. Also, I want to point out that application fees are paid per application, not per provider. And I'll point this out as we go through a little bit more. But an example would be if you have a provider that is a new enrollee and they're enrolling in multiple states. Let's say they're enrolling in Iowa and Kansas. You have to submit separate applications for those states. And in turn, you also have to pay a separate enrollment fee per application. And these application fees are also part of supporting fraud prevention activities that happen. Again, not necessarily just the site visit. There are other activities that have to happen. So keep that in mind. So the fee amount is something that is set by CMS, and they are leveraging the Consumer Price Index on an annual basis to set that fee. For 2024, the fee is currently $709, and that is something that does typically change annually, usually about mid-October, beginning of November. Certainly by the beginning of November, CMS is starting to roll out and release what that fee is going to be for the upcoming year. So you will have notice of what that's going to be. It won't be just a surprise. That is posted on their website. And I'm going to go out to that real quick. So there's a couple of ways you can get to this. So I'm going out to CMS's website. One of the quickest ways, I don't want to say it's hidden, but it is a little bit. It's not its own separate resource. So when I come out here, what I usually do is I search for enrollment fee, and it's going to bring up a lot of provider enrollment information. Where you'll want to go to is this MLN. I'm going to go back so you can see that again. It's MLN 9658742. And again, I've provided that to you as a resource in today's material. This is a really good educational tool that CMS has available with high level how to get started with provider enrollment, and it does include a section specific to the enrollment fee. This page is where they will announce the new fee. And as you can see, they'll make it bright, colorful, so that it sticks out, so that you can see it and that you can't miss it. And then it's going to include some links. I'm going to come out to a couple of things out here throughout the presentation, so I'll go ahead and leave that out. And we'll be right back. So it is based on the fee submission year, though. Well, it's based on the application submission and the fee submission year. And what I say by that is the year that you pay the fee, you will pay that year's fee. So any application or any fee that you pay in 2024, you are going to pay $709, and that is the fee. However, we do run into situations, and you do need to be careful towards the end of the year. We run into situations where a fee will be paid in one year, and the application will be submitted in the next year. So the graphic you're looking at is an example of that. We will run into situations, and we did this year, where late December somebody paid an enrollment fee and they paid the 2023 fee. Can't pay the 2024 fee until January 1 of 2024. Then the application submission, for whatever reason, was delayed, and the application was submitted in January of 2024. The provider paid a fee. However, they paid the previous year's fee. That is something you want to be aware of, because what will happen in that situation is we won't be able to process the application because it was received in 2024. We won't be able to process it based off of the 2023 fee, and the provider won't be able to pay the difference because the system is set up to only accept payments for the full fee. In that instance, the provider would need to pay the 2024 fee to start moving that application along, and the 2023 fee that was paid prior, the provider would request a refund. And we'll talk about those refunds a little bit, but that is usually the only time you really have to worry about that. It's that end of the year as the switch is happening. So my recommendation to avoid that challenge is to not submit the application, or, pay the fee until you're ready to submit the application, likely on that same day, especially that time of year. So when is an application fee required? Again, it's going to depend on the provider, and we are going to go into that matrix next. But if you are a provider who is required to pay a fee, you are going to be required to pay a fee for initial enrollments, the scenario I gave where a provider is enrolled in multiple states. Again, when you're revalidating, so on that every 5-year cycle, that revalidation requires much of the same screening and verification and fraud prevention activities, and so they are asking for that enrollment fee to be paid just like you would for an initial. And then for adding new locations. Now, this is a little bit different than site visits. With site visits, you'll recall that we do a site visit every time you add a location. It's a new location. We have to go out and make sure it's operational. With application fees, it's a little bit different. With an application, it is when you're adding a new location that is going to increase the number of locations on the enrollment in question. So if you have an enrollment that currently has 4 practice locations and you add a 5th, an application fee will be required. If you have a provider enrollment that has 4 locations, one of those is moving, meaning we're going to end date one of those 4 and replace it with a new 4th location. That's not going to require an application fee. It did not in the end. When we remove the previous location and we add the new one, you still end up with 4 practice locations on the enrollment. That does not require an application fee. We also are not going to require application fees if there's a reactivation or if we're changing a practice location, which is what I just described is that one-to-one replacement. We're removing one, we're adding one. Or if you have a change of ownership, and this is typically a Part A situation, so those facilities that are filling out a CMS 855A, if you have a change of ownership, but the enrollment, the PTAN, the provider agreement with CMS is being taken over by the buyer, we're not going to need an application fee. If there's a new enrollment involved in that change of ownership, that's considered an initial, and again, we would need an application fee for that. And that is all made much simpler with this matrix. And I'll take you out to the matrix so you can see it a little bit easier. One second. So this matrix is broken down into 6 columns. So the first column that you'll see, and I know that that's a little bit hard to read, that's why I'm going to take you out to the web resource. That is going to be the provider or supplier type. You are going to see that it includes physicians and group practices. It's tried to be an all-encompassing list, so there's documentation of when a fee is not required. The other categories, 2 through 6, those are going to be the enrollment action being taken. So the second column here is for initial enrollments, and then you'll see that there's just yes or no responses in that column. Yes means an enrollment fee is required. No means that an enrollment fee is not. Third column is for revalidation. Fourth column is for change of ownership. Fifth column is for a change of information other than adding practice locations, so changing a name, changing a special payments address, changing a correspondence address, changing managing employees, AOs, DOs. Those aren't going to require an enrollment fee. And then the final column, the sixth column, is going to be addition of practice locations. And again, I want to point out, increase in number of locations on that enrollment. So with that, I'll take you out to that matrix. So here is the matrix, and I'll zoom in just a little bit if it'll let me. There we go. So that you can see that. So I highly recommend that you take a look at this. It is going to be a helpful resource. It's definitely something I recommend you bookmark if you're doing enrollment on a regular basis. Quick resource. And it is going to be really all-inclusive. As they make changes, again, they haven't made changes in a while. I don't anticipate from anything that I'm seeing that they're going to. This is updated, so this is, like I said, it's a fantastic resource. Again, this is not, though, indicating anything regarding that site visit requirement. This is just for the enrollment fees. So the enrollment process, when an enrollment fee is required, is going to run like this. The analyst is going to review the application. They're going to be looking for any missing information, but they're also going to be identifying if the application requires an enrollment fee. If they do, they are going to verify that that fee has been paid. And if they can verify that information, which is done in the PAYCO system, we do have a way to access that. The payment system does link up and is basically a part of PAYCOS, so that makes things easy for us to find. We're usually locating them off of the MPI, or if the pay.gov tracking number has been included, we'll be able to do that. If that fee has been paid, we'll process it, whether that is through to enrollment, assigning the P10, revalidating, adding that location, or if there's development. Now, if that fee is not paid, we are going to develop for that. However, this is going to be something that then you will have to pay within 30 days. At that point, we're going to talk about hardship requests, but if the enrollment fee has not been paid and we are developing for it, a hardship request is going to no longer be an option for you. At that point, if the fee is not paid in 30 days, the application would be rejected. The other thing they're looking for, though, is there a hardship request? If there is, and a hardship request is going to be a request for an exclusion from that fee, and again, we'll talk about that in a few moments. If there's a hardship request, that is going to be referred to CMS. However, that application will not continue the process until CMS either approves or denies that hardship. And again, we'll talk a little bit more on that in a minute. But the underlying tone here is that that fee has to be received before we can process the application, and that is per CMS directive. Here are just a couple of examples of what that's going to look like when an application comes in. So again, we're looking at the 855 submission, 2024 fee, or was paid, we're going to process it. If we have that submission of an application in 2024, fee is not paid, we are going to develop. In the situation that I mentioned earlier, where we have the previous year's fee paid. So if the fee was paid in 2023, the app was submitted in 2024, that is a situation that is considered the fee for that submission year is not paid and would result in a development scenario asking for that new fee. So how do you pay the fee? If you are required to pay that fee, it does need to be paid electronically. We cannot accept check or money order, certainly not cash. It does need to be paid by what oftentimes will be referred to as plastic card in the PAYGO system. It's just being paid electronically. So you can pay inside PAYGOs. There's a link here, and a link's being provided, again, is provided for you in your resources for today. But I'm going to show you where that is. So on this site that I brought you to earlier that has a lot of good provider enrollment information where you can see what the enrollment fee is for the year, there is a link to the enrollment application fee for 709. That link takes you out to the PAYGO system where you can pay that fee. I'm not going to be able to walk you all the way through, but I'll take you through the steps as far as I can. So this enrollment fee page is going to tell you the application types. Okay, so it's going to tell you the initial enrollment, the revalidation, the change of information. It's also the system that's used for DME, so you'll see some DME information. It's going to tell you the year, and it's going to tell you the amount that you're going to pay. Notice this isn't an option. You can't change this. So if you're always coming out here, you're always going to be paying the most current fee. There's no way that you'll be able to pay a previous year's fee. Once you hit continue and you acknowledge that, the system's going to ask you for some information here. And the information it's going to ask you for is going to be MPI, legal name, tax ID, and then it's going to ask you for the specialty. It's going to show you every specialty, including group practice. I just want to make sure that people understand this is a system configured list, and so it's not actually customized based off of who needs a fee. So make sure you're utilizing that matrix. It's going to ask for some contact information, state, so that it gets sent to the proper MAC. And then once this is filled out, this is where I have to stop because it will then say pay now, and it's a lot like online shopping. It's going to ask for your payment method, and then it will submit it, and you will get a confirmation. For paper applications, the process is very much similar. There is a different link for you there, and I'm going to go ahead and access that. Sorry, that link did not do what it should have done. There we go. And that link is very much going to take you out to that same page. It was already there, so it wouldn't navigate there. My apologies. So in lieu of paying the fee, a provider can request a hardship exception. This will exempt that provider from the fee. However, as I mentioned before, it does have to be submitted with the initial submission of the application. So if you submit an application without a fee or a hardship, hardship's no longer an option. If you've submitted the application, you're going to have to pay that fee. If you're submitting that hardship, it does need to be a written request, needs to be signed by the authorized or delegated official for the entity, and it has to include a description of the hardship. So the hardship would be something that is going to cause a financial hardship for the entity or the organization. That could be based on the type of service that's provided, the population that is served. It could be there's not a, how do I want to say this, there's not a set of standards that these will always be exempted. It is a waiver request that is available to all providers that may be asked to pay that enrollment fee, but they have to provide the supporting documentation of why this is, maybe it's the accounts receivable, but why is this going to be a financial hardship for the provider to pay? It is evaluated on a case-by-case basis, and it is evaluated by CMS. The MACs do not make this decision when this is received. As I said before, the MACs are going to forward that on to our contact with CMS that reviews these, and then CMS is going to review that request and the documentation to identify whether or not they believe a hardship exists. If we receive information that it's approved, we're going to continue processing that application. If it's denied, we're not denying the application. We are denying the hardship has been denied, and you will receive notification regarding that hardship denial. And then the contractor will be developing for the enrollment fee in order to process the application. But again, we'll not process the application until that fee is received. So refunds, they're not very typical, but the example that I've been using of paying the 2023 fee but submitting the application in 2024 and then having to pay that 2024 fee, that's a situation where that 2023 could absolutely be requested as a refund. You're not going to lose that. They will typically refund, say you've got a situation where it's paid in error, maybe it's the provider type. Again, with that drop down saying group clinic, sometimes we'll see group clinics that'll pay that fee. That's a provider the refund's going to be able to be put in and requested. Could be an application type. It's an add a location, but it's not increasing the number of locations, so it wasn't needed. So basically, if that was not needed or was paid in error somehow, that is going to be a time where there's an exception and that refund can occur. Now, to request that refund, it's important to remember the MACs are not processing the fee. The MACs can't issue the refund. However, the MACs can help you facilitate the request for the refund. So you can contact your MAC, ask for that refund, provide some information about the payment, such as the tracking ID, maybe the receipt. They will forward that on to CMS, and then CMS will go through the steps necessary to issue a refund and make sure that it's appropriate. And I also want to point out that that refund, it's paid electronically, so it will be refunded in the method in which it was paid. So if you paid on a credit card, it's going to go back on that card. All right, that brings me to questions. Bailey, do we have any questions in the chat?
There are no new questions.
All right, thank you. So before I leave you, I just want to point out that I've provided you with some resources from CMS. Again, that PIM Chapter 10. There are sections on application fees as well, so that information is there for you, and a few other sections that just kind of detailed some of those site visit inspections, so you have that information. The Medicare Learning Network article that I've referenced a couple of times, there are links to that article and the site specific to fees so that you have that for your resources, including that last one is that matrix. So please leverage that. That'll be super helpful for you. Also on our WPS-GHA site, we do have a provider enrollment application fee resource that will take you out to many of the items I've provided to you from CMS. So that's just another way of accessing that information. One more check-in. Bailey, did anything come in the chat?
Nope, nothing else.
Okay. And just checking in one more time, Bailey, do we have any questions?
We do not.
Okay. With that, that ends the presentation for today. On behalf of myself, Bailey, and everyone on the GHA Provider Outreach and Education team, I'd like to thank you very much for taking the time to attend today. I look forward to those survey comments. And again, please be sure you're including any topics you'd like to see in the future. I want to thank you again for attending today. Have a great day. You may now disconnect.